some of the diabetes patients that the doctor cannot forget. I will share at least three such patients I am going to share. Diabetes patient, one lady coming from middle class family. She is quite aged, maybe 65 years, and her son used to bring her regularly. Once I said, you must come regularly. Whenever there is some problem, you should come once in 15 days, once in a fortnight, that is once in 15 days she must come. And regularly she must come once in a month. Once in 3 months, glycated hemoglobin. Once in 6 months, lipid profile, renal function test. Like that, everything I have explained. Once in a year, ECG, echocardiogram, cardiologist opinion, everything I have explained. And mind you, she has followed. And also one day I was overwhelmed with joy because she brought my prescription slip starting from 2009. Now it is April 2021. So starting from regularly, sometimes once in 15 days and regularly once in a month, starting from 2009, now it is 2021. Completely she used to bring regularly. It was very difficult for me to put the stapler, so many sheets, almost this much. And then one day I said, okay, you keep all this prescription slip, and I will write very important points regarding what is the average blood sugar, and what are the different treatment that I have advised, everything, and you keep a book. And she brought one Lekak book. The son brought a Lekak book, and I was very happy. I wrote her name and I put my seal, and then I wrote the blood sugar, blood pressure and everything, and I advised, and she was also happy. And I told her, extremely happy that you are preserving the sleep starting from 2009, and henceforth you keep those slips in your house and then bring that Lekak book only. And she said yes. So this is one instance, extremely good patient which the doctor cannot forget. Another one, the daughter, she used to bring the mother for treatment of diabetes, for my advice, and she used to come from from a remote village near Kanakpura. So she has to travel by bus, mother and daughter. They have to travel by bus from that interior village to Kanakpura, and then another bus from Kanakpura to Bangalore city market, and then from city market to my clinic by auto. So really a tedious thing. And she used to bring the mother regularly once in a month and strictly, and I was very happy regarding the improvement, and she has improved. The blood sugar is reduced, blood pressure is under control. Regularly she is taking the treatment and all that. One day I said, if the mother is suffering from diabetes, chances of the younger one to develop diabetes is very high. And if the mother is suffering from, the parents are suffering from blood pressure, chances for the young one to develop blood pressure is as high as 48%. So, and she said yes. When I checked the blood sugar was more than the blood sugar of the mother. In fact, the mother's blood sugar was under control because of the regular treatment. Whereas the daughter, when I checked, the blood sugar was very high. That is, for the first time I recognized that she is diabetic. Not that she is diabetic from that day onwards. She may be suffering from diabetes. She may be diabetic since many years before. But the doctor has not recognized and the patient has not noticed, because diabetes in the beginning, they will not be having any symptoms. The diabetic people, the hypertension people, they go to the doctor with the complications. Once they develop the complication, especially, sir, I am having burning sensation in my legs. Sir, I am having some sensation which some ants are crawling on my leg, something like that, that sensation. I am not in a position to feel the pain or the sensation of my leg. Sometimes, the slippers, sometimes, I will be walking and I will not notice that the pain caused by some stones. I put the leg on the stone or something like that, I will not be in a position to feel the pain. Then, I said, you must be, probably you have developed the complication of diabetes. That is diabetic neuropathy. the nerves are involved, and regularly we have to refer the diabetes patients to the eye specialist for examination of the retina. Unfortunately, retinopathy, which the patients have developed, most of the patients, they will not be knowing that they have already developed the retinopathy, the complication of diabetes. Because if they develop cataract, even the cataract also they develop little early because of the diabetes. But if they develop cataract, they go to the doctor, go to eye specialist. But if they develop retinopathy, till it is advanced, they will not be in a position to recognize. So we have to refer the patients to ophthalmologist, eye specialist as early as possible. We have to refer to cardiologist. It is easy. I have taken the ECG and it is normal. No, they go for silent myocardial infarction. That means they go for silent heart attack. So early diagnosis and proper treatment so that they live longer. One of the theme for the World Health Day of 1 year was full life despite diabetes. In spite of diabetes, they will be in a position to live longer if they receive by the diet plus exercise plus drugs, and unfortunately diet plus exercise plus drugs plus insulin. If I put the patient on insulin, if I say insulin, they say, sir, throughout our life we have to take insulin. Not necessarily. If the patient follows the doctor's advice, and if the blood sugar, if it is controlled, doctor will be in a position to reduce the dosage of insulin. And one particular point of time, I have stopped insulin, and then the patient is on regularly controlled. The blood sugar is controlled only by drugs. There are so many instances because of the diet plus exercise. Friends, this is very, very important. And another patient, the last patient which I want to share is, sir, 2 years back I came to you and you said I am diabetic, and whatever the treatment that you have advised, even today I am following. I am following the same treatment since 2 years. 2 years back I came to you. I felt very bad. And he said, sir, no problem. Yes, diabetes people in the beginning, they will not be having any patients. Mind you, even the cancer patients, in the beginning, they will not be having any patients, any pain, or they will not be knowing that they are having the cancer. They will not be knowing that they are having the diabetes. They will not be knowing that they are hypertensive. So it is the responsibility of the doctors to educate regarding the importance of early diagnosis and proper treatment so that the patients will not develop any disability. Thank you very much. Please pass on this information to others. Sarve Jana Sukhino Bhavatu, Sarve Jana Swasti Bhavatu.